A new study of 4.8 million people in Canada says that one daily alcoholic beverage will not send anyone to an early and will not offer any of the health benefits suggested in previous research, even with organic red wine. Researchers from the Canadian Institute for Substance Use Research explain that low and moderate drinkers have similar rates to those who abstain completely. On the other hand, women who drink more than one standard drink a day are at least 20% more likely to die prematurely. More women than men. The study, published Friday in the JAMA Open Network Medical Journal, comes just after a report from the Canadian Centre for Substance Abuse and Addiction that said Canadians should not drink more than 2 alcoholic drinks per week to minimize their health risk associated with alcohol. Principal investigator Dr. Jinhui Zhao and his co-authors wanted to better understand the link between alcohol and all-cause mortality, including theories developed in previous studies that small amounts of alcohol may benefit health, that moderate drinkers live longer and are less likely to die from heart disease than non-smokers. They reviewed 107 studies involving 4.8 million people between 1980 and 2021 and found that consuming more than one standard beverage per day significantly increased the risk of prematurely, especially for women. In Canada, standard beverage is defined as 341.5 alcohol beer or cider, 142 ml glass of 12 per spirit wine, or 43 shot 40 spirit. Each standard drink contains 13.45 grams of pure alcohol. There was a significantly increased risk of all-cause mortality between female smokers who drank 25 grams or more per day and male smokers who drank 45 grams or more per day, the authors wrote. WE's protection against from all causes. When they looked at previous studies suggested that people who drank little were less likely to die early or from heart disease than those who never smoked, they found the evidence was skewed by systematic bias. For example, light and moderate drinkers are systematically healthier than current non-smokers in terms of a number of health indicators that are unlikely to be associated with alcohol use: dental hygiene, exercise routines, diet, weight, income, they wrote. Meanwhile, those who stop drinking may be statistically more likely to experience worse health, as many have had to stop drinking for health reasons or have never started in the first place. They also found that most of the studies they reviewed overrepresented older white men in their data, failing to take into account the experiences of women, racialized people, and people from D.